So my name is Jim Arbuckle. On October 29th of 2020, I was in a serious bike accident where I hit my head on a tree and became totally paralyzed. They took me to HCMC and they fused 3, 4, 5, and 6, put a halo on my head for C1 that was broken on both sides, and put me in ICU for 4 days and then 3 weeks in rehab. And after 3 weeks, I was able to walk out of HCMC, but had very little use of my arms and hands particularly, did not come back as well. They told me after 3 months that that was as good as I was going to get, and unless things got worse, don't come back and see him again. So I met Dr. DeYoung on an airplane and happened to tell him that I had a problem, and he spent 2.5 hours on the plane telling me about his cure. And when I got off the plane, I made an appointment. So now it's been a month later, and my arms that would not do this, would go to here, now comes all the way up. It's a little bit of a stretch this morning to get this, but I've got good hope that I get the rotation in that shoulder again, where I couldn't before. The left hand is a little bit behind. It's about half of what the right hand is. But
today, how high did it come in today? How high could you lift them?
Today, I came in like this.
That's all the high would go today, and we made that change.
And that happened within a few minutes. It wasn't real pleasant, but we got it. And so no pain, no gain.
Oh, look at that. But that's a huge change for what we did in 15-20 minutes compared to months and months of not being able to change it all. Look at that.
Exactly. So I am very pleased and have some exercises I can do at home to keep that stretched out and keep that happening.
That's amazing. So glad to see it. Well, I don't know if there's anything else you want to add.
No, just got my determination this is going to happen, and Dr. DeYoung is going to make it happen. So it takes a doctor really to do it. I couldn't do it on my own.
Okay, but you are determined. Okay, there you go.
Hi, this is Shirley Smith, and I'm a fairly new patient of Dr. Roberts, and I've been going here for approximately 5 weeks. I came here initially because I had so much pain in my feet from neuropathy because I'm diabetic, and I also had a major accident where I had a concussion, and so I was having a lot of headaches. Since coming here...
How long have you had the pain in the feet, and how severe was it?
The pain in my feet I've had for 15 years, and I would put it at a 10, similar to walking on glass or pointy rocks. And my feet issue has changed. From now it's more of a burning, and it's down to maybe on a scale of 1 to 10, a 4.
So from
and
a
so
10
I've seen great improvement.
Down to a 4. And how is the feet every night for the last 15 years affecting you? What would happen with sleep?
So most nights I would wake up multiple times during the night from a sound sleep because of the pain in my feet, and it would just be a number 10 for several minutes, like a 30-minute issue, and then I'd be able to fall back asleep, but then I'd wake up again in a couple hours, and I had that for more than 15 years.
Yeah.
Now I wake up maybe once a week, and the pain, instead of being a 10, is again like a 4.
Wow.
So big improvement.
Yeah.
My concussion is changed from headaches 24 hours a day, 7 days a week, to 0. I have no headaches whatsoever. So that's 100% cured, I would say, or gone.
Yeah. And anything different about meals and eating and after eating?
I also had another problem with irritable bowel syndrome that was very significant. In fact, I was taking Imodium every other day. After 3 days of seeing Dr. Robert, I stopped the Imodium, and I've not taken one since. So I look at that as 100% change.
Yeah, just amazing change, because that was for years.
Right.
Yeah. And very hampering.
Yeah.
Very hampering. So
overall, I feel much better, and my family keeps telling me how much better I look.
Well, thank you for
Thank you.
sharing.
I am Jenny. I'm 41, and I've been dealing with issues from Hashimoto's for about 20 years. Mental clarity has gone away. Lots of brain fog over the years has gotten worse. And also about a year ago, I was kicked in the knee by a horse, and we also had a concussion from the fall. And with 2 treatments, I'm starting to already get better. When I went in for my knee, there wasn't much that they could do for me. They tried pain blocks that didn't work.
What kind of pain were you having in your knee after the horse kicked you?
A horrible pain. I've never experienced such pain in my life. I couldn't walk. I couldn't do much for a long time, and still a year later, I'm feeling very disabled.
Was it pain every day now?
Pain, always pain. Yeah, it's been.
What kind of level from 0 to 10?
Well, in the beginning, it was a 10 every day. It slowly went down to a 5 or a 6, and then I started just mentally living with the pain. And so I have to walk sideways up the steps to get up and down steps.
Yeah.
And I can't do a lot of physical activity. So they really, when I went into the doctor, they didn't know what to do with me because nothing's broken, nothing's torn. So
Yeah, like you said, you had pain blocks. What else did they give you?
that's all they really offered me. They didn't even offer me any pain medication. So it's been difficult, and I've had a hard time sleeping. I've tried a lot of natural methods that kind of take out some of the sting, but they really don't help.
Yeah. And so, how long have you been here now? How many visits?
So I've been here for a couple of weeks and had some treatments with the paleotherapy and with QNRT and the quantum neurology. And I've experienced mental clarity that I can't remember the last time where I felt like that, and I'm feeling more empowered.
How old has been the last time you've had that mental clarity, you think? Before you're diagnosed, or how old were you?
Well, before I was diagnosed, probably in high school.
High school.
But I've been dealing with Hashimoto's for half my life, and who knows how long before that I really had things going on. So it's pretty amazing that I feel like I can move more too, which is amazing. And after the QNRT, that I felt a release in my knee from other stuff. So
amazing, right?
It's kind of incredible.
So you're having that 5 or 6 out of 10, and now what do you have in the knee?
Now I'm like at a 3.
Like a 3.
So
fantastic
that's
change.
Really huge.
Yeah. So that's great in just in a couple visits or 2 weeks.
Yeah.
So, and then as far as the mental clarity, like this has just been a big change.
That's a huge change. Yeah. I haven't been able to remember things, and I feel more free in my mind. So.
All right. Well, thank you for sharing.
Yes.
Hi, I'm Audrey Taylor, and about 2 weeks ago, I got a concussion in basketball. Got hit on the side of my face, and since then I had like really bad headaches, like pounding headaches, and was nauseous and light sensitivity, and I like couldn't do homework, and now I like don't have any headaches or light sensitivity or any of that anymore from doing QNs and mudding and QNRT, and yeah.
One day after the mudding, she woke up without a headache. So
And I slept through the night.
And
I
she-
wasn't
yeah,
sleeping
that's
through the night
right.
either.
Yep.
Yeah.
She slept through
For
the
a
night.
week, you weren't sleeping through
No,
the night.
I like
Mhm.
never like not sleep through the night, and then after I got hit, I was like, oh, I'm up at 2 in the morning.
Mm,
Yeah.
yeah, so it worked, and we're really happy.
Yeah.
It's nice to, and school's happy because she can get back to her homework.
Yeah.
All right. So I guess, if you had to say what was most significant, I guess what you noticed, I think it sounds like the mudding made a huge difference
Yeah,
in QNs.
so.
And
Yeah,
well, kind of all of it together, but
yeah, I'd
Yeah.
say the mudding and maybe the QN, is that what
Yeah.
we did
Yeah.
in here? It
Yeah.
was that day doing both, that
Yeah.
we saw a big difference.
Yeah.
Mm-hmm.
very
The
cool.
next morning, yeah.
Okay, well, thank you for sharing.
Thank you.
Awesome.
My name's Sam. I came in here to see Dr. Robert for my neck injury. I was injured in football 5 years ago, and basically my head got thrown down with my helmet. They grabbed my helmet and I threw my head down, and I healed probably about 70% with physical therapy and stuff. And it just kind of got worse, and basically 2 muscles in the back of my neck 5 years later felt like it was the only thing holding my neck together. And when I got to see Dr. Robert, he was able to get the sides of my neck working again and get everything so it can get stronger. And the muscles are able to heal, and they're able to stay loose so that I'm able to get stronger, and it's been a big help.
What percent better from, when you came in, you say that, you're at what percent, and then now what percent better are you now?
I always say I was like at a 30 or 40% when I came in here. Now
So,
I'm got to be 95% at least.
So it felt very unstable.
Yeah. Like
When-
I had a herniated, or not herniated. I just had a small protrusion on my C5 vertebrae,
Mhm.
and I got that from mountain biking. I didn't even fall off my bike.
Yeah.
It was so weak.
The muscles weren't protecting.
Yeah, they weren't protecting my neck. It was just, and now I can take a fall. And
Yeah.
I'm fine.
Yeah.
So.
Yeah, so for those, you can relate when you say like your head feels very heavy compared to what it should, or,
Yeah.
the concerns, I guess, what concerns would you have over leaving it that way?
Well, it was the residual pain. I had pain all the time. I couldn't exercise because it would just get worse every time I exercised.
Mhm.
So, and now being able to actually exercise and put on muscle properly is a big help.
So is it night and day difference at this point?
Oh yeah.
Would you say you're fairly healed up or fully healed up, or what?
Oh yeah, I'm healed up for sure. It's been nice because like I've noticed I used to work out and things would take a couple days to heal, and I think it was because the neck was still trying to heal my neck. And with the neck healed, I mean, shoot, I could work out and be good the next day pretty much. So
No problem.
yeah.
Okay, well, thank you for sharing.
All right. So pre-accident,
Introduce yourself.
I'm Alison, who was in an accident. My name's Alison. I came here to Functional Medicine Center because I am recovering from a post-concussion syndrome. I was in a motorcycle accident 3 years ago, and prior to that, full-time business owner, mental health counselor, fully functioning, not a lot of problems in my life. Accident was 3 years ago, and my whole life stopped. Everything changed. Broke my neck. Have been in recovery. It was in a neck brace for 13 weeks, and I discovered post lots of treatments that that being in that neck brace probably set my visual field into a frozen state. And so when I was trying to recover, it made it super hard because turning my head was not easy. So I've done a lot of treatment, but I came to a point where in order for me to function, be able to be out in the world, I was using a cane to walk. I was using a hat 24/7, well, not when I was sleeping, because then I was in the dark. Earplugs to go into any situation. Being in stores was terrible, hated all the stimulation was way too much. So when I showed up here at Functional Medicine Center, I walked in the door.
Dark glasses.
Dark glasses, yeah. Cane, hat, and that was my normal. That's who I was. And I have spent the last 3 weeks here doing intensive treatments, and I do not use a cane anymore, and I'm able to be out in the world without my hat on. If I wear a hat now, it's because I'm in my convertible and I don't want my hair blowing in my face, which is a totally different reason. The glasses that I do wear have prisms and what are called ocular binasals. I do a lot of vision therapy, So I'm hoping to get out of those at some point. They do transition to sunglasses, but wow, have I come a long way.
Well, be able to turn your head.
Oh yeah, and watch this. Da, 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 da. And the other day, I went to open my car door, and rather than turning my whole body to open the door, I was like, hey, I'm just opening the car door, like turning and looking at it. And when you go 3 years without turning your head, that kind of stuff is noticeable. So thanks for reminding me of that.
Yeah.
It's really big.
Anything else with that? Emotionally different because of what we've done here? Is that something you've noticed?
Specific, like, should I go QNRT emotion or, concussion? A lot of breakthrough crying, a lot of depression, not feeling stable, feeling so discouraged and so depressed about my limitations and not being able to do the work that I love to do. And I just have a complete sense of hope. I have a so different picture of there's possibilities for me. I don't have the breakthrough crying like I did at all.
Nice.
I just feel so hopeful.
Yeah. All right. Well, thank you for sharing.
Yeah.
I'm Emily. This is my mom, Nancy. We are here. We've been getting some treatments now for the last month. Prior to starting to work with Dr. Robert here, my mom had a head injury where she had a concussion when she was hit by a car in a parking lot about 6 or 7 years ago. Has never been the same since then.
As a pedestrian getting hit.
Yeah, she was walking and then fell and hit the head. And has never really been the same since then. We've tried to find answers. We noticed changes in her sleep, in her balance, and her strength, some memory fluctuations. We went to countless doctors and neurologists and specialists and had every test done in the books, and we're always told that this is just normal aging. There's nothing more that can be done. But we were never really happy with that answer. And now we found Dr. Robert, who's been doing a number of different treatment modalities, and in the last month has been incredible what we've seen. We've got better balance, her sleep is getting better, her confidence is getting better. She's out working in the yard, which she hasn't done for years.
What would she do instead of working in the yard? She'd always walk on the sidewalks.
Yeah, so like there's sidewalks and a back patio, and she always just limited her outdoor activities to those paved areas, never go in the grass where it was bumpier and steady because of the fear of losing balance and falling. So now she's back to doing things that she likes doing.
I had a knee surgery 4 years ago, and I was in pain for almost since then. It got a little better recently. The head let up a little bit, but still getting up and down and moving around, walking. I couldn't handle much of it, and the pain's gone. The mobility has gotten a lot better.
What are you doing in the yard now?
Oh, I'm mowing lawn and planting flowers and raking, and it's just been wonderful. It was a long, hard winter. It was very, very hard, mentally and physically on me.
Yeah.
And I'm just feeling like a new person.
So since I had injury, this is what kind of change?
This is amazing.
Yeah.
This is the first time that we've actually seen change. I feel like I'm getting my mom back.
And that was how many years ago was that head injury? I think you said
6 or 7
6
years
or 7
ago.
years ago. So I think that's a word for other people who've had many years even after the head injury. They say there's nothing more that can ever be done.
Right.
And that's the same.
And that's what we were told over and over again. And after the first evaluation with you, and you said, this is what's going on, and I can help.
And with my
Me
knee,
and my mom celebrated
and
that.
with my knee, I went to therapy 4 times, and they discharged me and say, nothing more you can do. You're not improving, so I don't keep working with you. And it just told me you took tests and said you have arthritis and there's nothing you can do for it.
Mm-hmm.
So then I just knew that, at my age, things are just going downhill.
So you're happy to find out that's not the
Yeah,
case.
I'm happy to find out that's not the case.
Yeah.
And my whole family's happy and we're all happy.
Very great. All right. Well, thank you for sharing.
I'm Haley. I'm 20 years old, and I had 5 concussions in my high school basketball career. And I was dealing with headaches every day. I was falling asleep but waking up like 10 times a night, taking naps but not actually feeling rested. I couldn't jump without getting dizzy, and I was just kind of feeling miserable every single day. And I tried going to other doctors who just said, like, just rest and stay in the dark, stay off your phone, all that kind of stuff, and it was never helping. And then I came to Dr. Robert, and I'm sleeping all the way through the night now. I'm not waking up at all. I don't have a headache every day, and I can jump and actually do things without feeling dizzy, and I feel normal every day. It's not always feeling like gross or groggy or anything like that.
Okay. And then, Mom, what's your
I'm
comments?
Angie Braun. I am Haley's mom. I decided to bring my daughter here because we have tried a lot of different things, and the therapy that they wanted her to do was going to be about 9 months long, and she was going to be leaving the state soon, so I decided to try something different and bring her here to see if we could get a quicker recovery.
Mm-hmm.
And it's happened.
How long? Well, how long
I've
did
been here
I've been
for
here
2 months.
I think I started in November, and then today's my last day,
Yes.
so about a month.
A month.
About a
oh gosh,
month.
that's right, a month.
Mhm.
1 month? But how long before you noticed changes, real changes in your life?
After like my first thing of mudding was completely done, I did not have a headache every day. And then after we worked on, so that was probably like a week.
So we say mudding, but that's like fixing interference fields, old
Yeah.
physical traumas.
Yeah, so that was like a week, I think. And that was getting rid of all of my headaches pretty much. And then once we started doing the QNRTs and the QNs, I didn't really have anything.
Nothing.
So I'd
Yeah.
say like 2 weeks.
2 weeks, you got rid of all of that. How many years were you suffering with this?
Like every day, probably like 2 years.
Yeah.
And I've noticed that she's not napping as much at all. She seems happier. Yeah, she's a different person.
Why would you want others to come here if they've had concussions?
I would want others to come here because if there's a way that you can get results faster, I do it, because it's hard to watch somebody who has concussions go through this daily and not feel good daily, and it's just hard on others around them and them. And so I would suggest doing it so there's no more, the suffering is just, it's unbearable sometimes. So I would definitely take a route where that's more natural and quicker.
Hi, my name is Shirley, and I wanted to talk to you today about a concussion that I had. 3 months ago, I had a concussion from a fall on an escalator, and since I've been seeing Dr. DeYoung, I have not had a headache at all. And prior to that, I was having headaches 24/7, and they were very, very annoying and painful. And within 3 weeks of seeing Dr. DeYoung and doing mudding and other treatments, I no longer have headaches at all. Zero. They're 100% gone.
Yeah.
And I'm feeling much more energetic and peaceful for that.
And I was referred to Dr. Robert by 4 other people, separate. So I finally came in, had a concussion 2.5 years ago, and have been doing regular Western medicine ever since, and was suggested to come here because nothing was really helping. So I've been here 2 this is my third time. When I started, I had light sensitivity and could not look at my phone. I'd have to look at it sideways. And
Even
it
then,
would last about 5 minutes, maybe 10, and my eyes would totally water and I'd have to shut it off if I got that far. And now I can look at my phone straight on and look at Facebook actually, and I fixed my passwords. So that was big. I went back to wearing my regular glasses without a tint in them, and I'm in this room with fluorescence, and I don't think I'm squinting too much.
Normally, what would that be like?
Otherwise, I'd be like this with my eyes. It would be very hard to see, and I would get a headache from the sun or the snow or anything like that. And today I drove without sunglasses all the way here.
Yeah.
And no visor down or any shading.
Yeah.
So.
And then what about at night?
Oh, and at night I noticed this after the second time.
Well, what was it like before coming in?
I could not drive on the way. I could not drive at night on a 2-lane road without looking to the side. I couldn't look at cars coming on to me. They would blind my eyes, and I could just barely make out the white line on the right side. So, but I couldn't see, like if there was somebody in the road or anything in the road, I would not be able to see that.
What's different
and now I had cars coming at me, had my head up, and I could have them pass by me without any problem. And I could see on the side of the road, which was very cool.
Yeah. Way safer and like
almost getting back to normal. It was.
What percent better would you say, even in the first couple visits? What better for the?
I would say
sensitivity?
75 to 80%.
Really? Yeah. That's only been 2 visits at that point. Yep. And then what did we do on your first visit? What treatment do you remember?
We did the detoxification.
The pelotherapy.
Pelotherapy.
Mud and clay. So huge when we remove those on your head too.
Yeah.
So
the head and the neck we did first. So.
Very good. Any advice for people who are, in the same situation you were in prior?
I've done a lot of doctoring, and this is the first thing that's really made a difference. And it was fast. So.
It's quick.
Yeah.
Yeah.
I was skeptical, but I am a believer now.
All right. Well, thank you for sharing.